Can an active sex life really lower your risk of prostate cancer? Welcome to a journey of exploration as we unravel the intriguing correlation between an active sexual life and the risk of prostate cancer. Prostate cancer, a common yet often misunderstood condition, affects numerous men worldwide. It's a subject that sparked countless debates and research efforts. So let's take a moment to put aside the myths and misconceptions and instead focus on the facts. Now let's delve into the science behind this compelling question. Before we proceed, let's understand what prostate cancer is. Prostate cancer is a type of cancer that occurs in the prostate, a small walnut-shaped gland in men that produces the seminal fluid that nourishes and transports sperm. Now, the tricky part about prostate cancer is that it often grows slowly and initially remains confined to the prostate gland, where it may not cause serious harm. While some types are aggressive and can spread quickly, the majority are not, which is why it's so important to understand the symptoms and risk factors. Common symptoms include trouble urinating, decreased force in the stream of urine, blood in the urine, discomfort in the pelvic area, bone pain, and erectile dysfunction. However, sometimes there are no symptoms at all, especially in the early stages. Risk factors include age, with the risk rising after age 50, race, where for reasons not yet determined, Black men carry a greater risk than men of other races, family history, and obesity. Regular screenings are crucial because they can detect the disease in its early stages, even before symptoms appear. Screenings generally involve a blood test called a prostate-specific antigen (PSA) test and a digital rectal exam. The importance of early detection cannot be overstated. Caught early, prostate cancer is more likely to be effectively treated. If left undetected, it can spread to nearby organs or travel through your bloodstream or lymphatic system to your bones or other organs, and treatments may not be as effective. It's important to have regular conversations with your doctor about prostate health, especially if you have risk factors. These conversations should include when to begin prostate cancer screening, the pros and cons of screening, and how often to get screened. Now that we understand what prostate cancer is, let's look at the research linking it to sexual activity. What does the latest research tell us about sex and prostate cancer? Let's delve into the fascinating world of scientific research, where we'll try to unravel the possible connections between sexual activity and prostate cancer. When we talk about latest research, we're referring to studies conducted within the last 5 years, providing us with the most recent insights into this topic. So, what have these studies been saying? Well, some research suggests a link between high sexual activity and a reduced risk of prostate cancer. Yes, you heard right. One particular study, for instance, discovered that men who ejaculated more frequently, around 21 times a month, had a lower risk of developing prostate cancer compared to those who ejaculated less often. However, before we jump to conclusions, it's crucial to understand that these studies are observational in nature. This means that they observe patterns and correlations, but they don't establish a cause and effect relationship. In other words, while these studies found a correlation between high sexual activity and a lower prostate cancer risk, they didn't prove that the former causes the latter. Now, you might be wondering, why would such a correlation even exist? Well, one theory suggests that frequent ejaculation might help clear the prostate of harmful substances that could potentially lead to cancer. Another theory posits that it could be related to hormone regulation that occurs during sexual activity, but hold on, the plot thickens. Other studies have found no significant association between sexual activity and prostate cancer risk at all. In fact, some research even suggests that high sexual activity in younger years might increase the risk of developing aggressive prostate cancer later in life. So, we have a bit of a scientific puzzle here, don't we? On one hand, some studies suggest that more frequent sexual activity could potentially reduce the risk of prostate cancer. On the other hand, other studies suggest that there might be no significant link, or even an increased risk. What's more, these studies also have their limitations. For instance, they often rely on self-reported data, which can be subject to recall bias. Moreover, they usually don't take into account other factors that might influence prostate cancer risk, such as diet, lifestyle, and genetic predispositions. So it's a complex picture, and we need to tread carefully in interpreting these findings. As the saying goes in science, correlation does not imply causation. Just because two things appear to be related, it doesn't mean one is causing the other. While these findings are intriguing, what do they really mean for men's health? Well, We'll explore that question in our next scene, where we'll discuss how to interpret these findings and their practical implications. Stay tuned for that. Opening, how should we interpret these research findings? And that, dear listener, is the $64,000 question. When it comes to research, correlation does not always equal causation. Just because there seems to be a link between frequency of sexual activity and a reduced risk of prostate cancer, it doesn't necessarily mean that one directly causes the other. There could be a third factor at play here, a confounding variable that we haven't yet identified. For instance, it's possible that men who have sex more frequently are generally healthier, more active, and lead more balanced lifestyles. These factors are already well known to contribute to overall health and could indirectly reduce the risk of developing prostate cancer. Alternatively, more frequent sexual activity could simply be a marker of good health rather than a cause of it. Moreover, we must not forget the limitations of these studies. Many of them are observational, meaning researchers simply observe and record what's happening without controlling for all variables. This leaves room for bias and error. The participants in these studies may not represent all men, as they often include mostly volunteers who are healthier and more willing to share personal information than the general population. The studies also rely on self-reported data, which can be inaccurate. Men may not remember their sexual activity accurately, or they may exaggerate or underreport it due to social desirability bias. So, while these findings are certainly interesting and warrant further investigation, they should be interpreted with a grain of salt. More rigorous controlled studies are needed to confirm these findings and to explore the potential mechanisms behind this observed correlation. In the world of science, every answer tends to lead to more questions. And in this case, the question remains, is there a direct link between the frequency of sexual activity and the risk of prostate cancer, or is something else at play? Closing. So, should men change their sexual habits based on these findings? What are the practical implications of these findings? That's the question we're grappling with now. It's important to remember that while the connection between sexual activity and reduced prostate cancer risk is intriguing, it's just a piece of the puzzle. Let's consider this in the broader context of men's health. For starters, research like this should never be the sole driver of changes in your sexual habits. It's crucial to understand that maintaining a healthy sex life is about more than just trying to stave off disease. It's about intimacy, connection, and mutual satisfaction, aspects that contribute to overall well-being. Moreover, it's essential not to overlook the importance of other proven preventative measures. Regular exercise, a balanced diet, and avoiding harmful habits like smoking can significantly reduce your risk of developing prostate cancer. Now let's talk about screenings. Regular prostate screenings are a must, regardless of how active your sex life is. Early detection is crucial in managing prostate cancer effectively and increases the chances of successful treatment. In the end, while this research provides some food for thought, it's not a magic bullet. Every person is unique, and what works for one might not work for another. The best approach towards prostate cancer prevention includes a combination of a healthy lifestyle, regular screenings, and yes, a satisfying sex life. The key takeaway here is the importance of regular screenings and a healthy lifestyle. So, does having more sex reduce your risk of having prostate cancer? Well, based on the points we've covered in this discussion, the research does suggest a correlation. Studies have indicated a trend where men who are more sexually active tend to have a lower risk of developing prostate cancer. However, it's crucial to remember the golden rule of research. Correlation does not imply causation. While these findings are intriguing, they should not be interpreted as a definitive prevention strategy. The complexities of human biology mean that a multitude of factors could be at play. It's also important to recognize that the research on this topic is ongoing and evolving. So what's the bottom line? The best way to reduce your risk of prostate cancer remains through regular screenings and maintaining a healthy lifestyle. And remember, always consult with your healthcare provider for personalized advice. This ensures you'll have the most accurate and up-to-date information applicable to your specific circumstances.